This video will teach you about the final steps of the discharge process. It is recommended to complete these last steps after the physician has completed the discharge medication reconciliation and follow-up instructions. To complete the discharge process, select the exit door icon located next to your various page options from your Patient Summary tab. A new window will open which will allow you to review, sign, and print the final documentation that will be sent home with the patient, called the Patient and Clinical Summaries. This documentation includes valuable information for your patient and the regular healthcare provider regarding their stay, such as their medications at discharge, what procedures were performed during their encounter, and any lab results. On the left side of the window, you will see the various sections to review, and on the right, you will see what the patient and clinical summaries will look like when printed out. The sections that are marked with a circle in front of the name are areas that need to be reviewed for completeness. A partially filled circle indicates that some materials have already been added for that section. You can review all education previously added during the patient's encounter listed below these sections. An empty circle will indicate that no materials for this section have been given to your patient. You may add any additional patient education or medication leaflets by selecting the notepad to the right of the section. A new window will open, allowing you to search for and add items. More detailed instruction on how to add patient education and medication leaflets is covered in a separate video. Once you have added all desired education, selecting the Sign button will return you to the previous screen. If a patient had already received printed out education for a specific topic, you can choose to not print out another copy by selecting the printer icon to the right of the topic. A red X will appear on the printer and will not print another copy with the patient summary. Please note that the red X over the printer icon will not remove the topic from the patient education given during their stay. The last section is documenting if the patient was treated for a medical condition that is considered to be a core measure during their stay. You can review what conditions are considered to be core measures by selecting the notepad icon. A new window will open listing the various core measures. If your patient was treated for any of the following measures, select the appropriate radio button. Additional questions pertaining to the specific core measure will then open, allowing you to chart additional details. Remember to sign the form by selecting the green checkmark located in the top right-hand corner. If your patient did not receive treatment for a core measure during their encounter, no charting will need to be completed for this segment. You can close the window by selecting the cancel icon in the top left-hand corner. After you have reviewed the information with your patient or their caregivers, you will need to document if they understood their discharge instructions. To complete this document, select the checkbox next to the yellow highlighted field at the bottom of the screen. The last step of the discharge process is to sign and print the discharge documentation. To do this, select the notepad icon for the Sign and Print section. Do not select the Print button in the bottom right corner, as this will not sign your documentation. If there is missing discharge documentation for your patient, a pop-up will appear indicating what item or items are incomplete. You must document an override reason or address the deficiency depending on the item. For example, if the diagnosis still needs to be addressed, you can select the appropriate override reason from the drop-down list options, since a nurse cannot add diagnoses. However, if an item, such as patient education, is missing, the nurse will need to select Cancel and go back to the previous screen to add the appropriate education. If the physician still needs to do the medication reconciliation, you will follow your unit protocol for contacting the provider to complete this section prior to the patient dismissal. Again, this would require the nurse to select Cancel until the MedRec has been addressed. Once the provider has completed their portion, the nurse can then return to the screen to sign and print out the discharge documentation. When all items are completed, the patient and clinical summaries will print out to the designated printer on your unit, and you will be returned to the patient's chart. This concludes the final steps in the discharge process.